And hello everyone, my name is Khairul and I am the leader of this group. So before we begin our presentation, I would like to introduce our group members first. So we have a four-member group, Chanjai, Eveli, me, Khairul and Muhammad Saiful.
A biomedical company fabricates hydroxyapatite granular as bone-graft substitute material. Prior to market, in vitro and in vivo biological evaluation must be performed on the material. Hydroxyapatite granular implant into a rabbit carvaria bone for in vivo biological evaluation. Unfortunately, after 2 months after implantation, the wound does not heal and the inflammation continues. Hydroxyapatite granular are encapsulated with fibrous tissue and blood vessel. Question 1. Predict and justify the biological response that leads to encapsulation of hydroxyapatite granular. The encapsulation of hydroxyapatite granular by fibrous tissue and continued inflammation indicates that the materials trigger a foreign body reaction, which is a chronic inflammatory response that the body uses to isolate and neutralize what it perceives as a non-compatible foreign object. In the initial days following implantation, acute inflammation occurs as the immune system sends neutrophil to the site to clear pathogen and debris. This is often followed by chronic inflammation, which can persist for weeks. This condition is characterized by the continued presence of mononuclear immune cells such as macrophage, lymphocyte, and plasma cell, along with tissue destruction and the proliferation of blood vessel and connective tissue. And lastly, fibrous encapsulation, which is foreign body reaction happens. The body attempts to isolate the materials by forming a fibrous capsule made of collagen, and this is often accompanied by angiogenesis, which is blood vessel formation to support the inflamed tissue. The surface and form of hydroxyapatite granular significantly contribute to the foreign body reaction. Firstly, the raw surface and high surface area of hydroxyapatite granulars can lead to intense macrophage and foreign body giant cells response. Secondly, the granular size, which larger than 10 micrometer, was too large for a single macrophage to phagocytose. This size is known to trigger frustrated phagocytosis, leading macrophage to fuse into foreign body giant cells.
My name is Muhammad Saiful Nazmi bin Syahidan. Today, I will present you about my case study is about the bone scaffold. My question number is we present is now question number two, which is suggest and describe at least three approach to overcome this problem. So, three approach to overcome this problem is first, conduct in vitro cytotoxicity testing according to ISO 10993-5. What is the purpose of conduct this approach is to check if the HA granule release any toxic substance that harms surrounding cell. How it's work? How it's work by soak HA granule in the culture medium to create an extract, then expose bond forming cell to this extract. Use MTS or similar assay to measure cell and viability. How it works? If the granule leach harmful chemical, this could trigger inflammation. Detecting this early allow the company to improve the material formulation or cleaning process before reimplantation. Second, perform histological analysis after in vivo implantation according to ISO 10993-6. So what is the purpose? To understand the type and severity of tissue reaction to the HA granule after implantation. How it works? Reimplant HA granule into animal bone like animal or mice, and after 2 to 4 weeks, analyze the tissue under a microscope for fibrous tissue thickness, presence of inflammatory cell and bone growth, and how it can help. Identify whether the material causes irritation, poor integration, or chronic inflammation. Describe further material refinement like shape, porosity, and composition to reduce negative tissue response. And the last, modify HA granule surface and evaluate immune response according to ISO OTS 10993-20. So what is purpose? To reduce the immune system overreaction, which cause chronic inflammation, fibrous capsule formation. How it works? Coat the HA granule with biocompatible material like collagen or chitosan, or modify the surface roughness and porosity to support better tissue and blood vessel growth. How it can help? By modify surface, reduce foreign body response and promote faster healing by encouraging bone cell and blood vessel to integrate with the implant, not reject.
Hello, my name is Khairul. Today I will be present for this topic, biological evaluation of hydroxyapatite granular based on ISO 10991. So this material is placed our inside body, especially for our bone. So it stay for long. So we call that permanent implant because if reach until more than 30 days, so we we consider it as permanent. So this biological evaluation for test for make sure that our material is biocompatible for our body before we use it. So from this table, we can say that cytotoxicity to check the material if kill or harms or cell. Next for irritation and sensitization to check if cause allergy or tissue reaction. Next, implant test to see how the bone reacts to material. Genotoxicity to check DNA damage. System toxicity to make sure it doesn't harm the other part of body. So some tests are you done with to test which is in vitro and in vivo, with in vitro in the lab and in vivo for animals. And then all these tests we can conclude that some of it in vivo tests include cytotoxicity, geneticity, and biodegradation are included in the vitro test. While in vivo are done with implantation, irritation, cytotoxicity, and biodegradation. So all these are selected part of a risk-based biological evaluation to ensure these materials are safe and effective to use it. Okay, thank you.
Next, I will present about question 4. The question is, imagine that you are the junior biomedical engineer that responsible to develop one scaffold as replacement of the hydroxyapatite granular. Propose new material and design consideration for the bone scaffold. Design consideration should include chemical, morphological, and mechanical properties of the biomaterial that will be used. As a junior biomedical engineer, I will propose a new material, bioactive glass ceramic composite using a composite of bioactive glass, for example, 4,5-S5 biogas and a biodegradable polymer, polycaprolactone, PCl. One of the key chemical properties is bioactivity of the bone scaffold material. Bioactive glass is known for its ability to form a strong bond with bone tissue. It forms a hydroxyl carbonate apatite HCA layer on its surface, which chemically very similar to the mineral base of natural bond to promote osteoconduction and osteoinduction. Next is biocompatibility. It's to ensure the composite does not trigger an adverse immune response or chronic inflammation. The surface chemistry of the scaffold will be designed to enhance protein absorption and cell attachment, either through the intrinsic properties of the bioactive glass or by surface modification, such as incorporating cell-binding peptides. Next is control biodegradability, where the degradation rate of the material should match the rate of new bond formation. Polycaprolactone (PCl) is suitable for this purpose as it degrades slowly over 12 to 24 months, ensuring the scaffold provides structural support throughout the bone healing process. From a morphological perspective, the scaffold should possess high porosity, 60 to 90% with interconnected pore ranging from hundreds to 500 micrometers, which is essential for cell migration, nutrient transport, and vascularization. The surface should also be modified to enhance cellular adhesion through the incorporation of nanoscale features of bioactive molecules like collagen or RGD peptides to encourage tissue integration and bone regeneration. Mechanically, the scaffold must mimic the properties of cartilage bone. With a compressive strength of approximately 2 to 12 megapascal and elastic modulus between 0.1 to 2 gigapascal. This avoids stress shielding and provides sufficient structural support during the bone regeneration process. The use of PCl helps reduce brittleness, thus improving toughness and resilience under physiological loading. That's all for our case study presentation. Thank you.